This short presentation is about the effect that the environment can have on fatigue. A number of these aspects are covered in the other accompanying webinars, and we would refer you to those for more detail. This will be a short overview. When we talk about the environment, we mean all the different dimensions of the environment. Of course, there's the physical environment that includes lighting, sound, temperature, the setting, the actual environment itself. Are you in a home? Are you in an acute care hospital? Are you in a clinic? There are also issues of privacy and surveillance that can affect fatigue. Those are all parts of the environment that we work in. And also the amount of access and control people have over getting out into nature or getting away from their workstation itself and having a restorative moment. And we'll talk a little bit more about that in a future slide. There's also the socio-emotional and the cultural aspects of the environment that can affect fatigue. So things like the types of supports people have, the expectations of the environment, and also the beliefs and values. And again, we'll go over that in a little bit more detail. And all the links and essential references you can find within these slides and on the accompanying handout that goes with this. So what is it about the physical environment that we need to attend to when we're thinking about modifying or reducing or preventing fatigue? Lighting is very important, and there's a whole webinar presentation in this series about lighting, so you should look there for more detail. But basically, any lux levels, and you can measure lux in your environment with an app on your phone or with a light meter, lux levels that are below 300 actually promote daytime sleepiness. So those could be a concern if you work in a particularly dim environment. A well-lit office building is usually around 500 lux. Outdoors, just to give you something to compare with, outdoors is between 5,000, 10,000 lux, right? So 300 lux is fairly dim, but a number of us find ourselves working in those types of environments. Heat, where it is particularly warm, in some settings, people have very little control over the temperature in the environment. Where it's warm, or if people have existing medical conditions, there's poor lack of circulation, air circulation, or the task is particularly physically demanding, as some occupational therapist jobs are. Heat can be a source of fatigue. Sound, one of the more popular things, unfortunately, continues to be open plan offices. Now, presentation number 22, that's all about noise, tells you a lot more about this in detail. But basically, when noise gets to be over 65 decibels, and that's quite easy to achieve in an open plan office setting, people start to have a physiological stress response. And if people also have hearing problems, that's even more accentuated. It makes it more difficult. After a while, we become cognitively, I suppose, desensitized to noise, and yet our physiological responses are still occurring. So even though after a while you may not notice that you're working in the middle of a lot of noise and cacophony, you're actually still having a physical response, and your body's producing stress hormones, and this all affects your fatigue levels. The setting, there's been a few interesting studies, not enough obviously, and unfortunately none specific to occupational therapy, but there was one study that found that when they looked at where nurses worked, the nurses who worked in the community were least fatigued. That setting was the least fatiguing, and those who worked in long-term care experienced the most fatigue. So that environment was considered to be more fatiguing for them. Then there are issues of privacy, and we're including the word surveillance and monitoring here. There is an increased likelihood in many people's work environments that their work is being monitored, what they're doing on their computers, or where they're driving to. I mean, we use GPS tracking, we use all kinds of filters on computers. And those sorts of elements in an environment can also be additionally stressful. And the stress then in turn can become fatiguing. So privacy issues and the ability to actually have a private conversation. And again, this sort of brings us back to those open plan offices that are not very healthy environments and are now being found quite clearly to be not conducive to effective and efficient work situations. And then lastly, and again, there's a presentation about this in much more detail, but in a nutshell, access to nature so that people can have restorative breaks. So do people have a window they can look out of? Do they have an easy way to step out of the building for a few minutes to just get a little bit of fresh air at lunchtime or on their break? Those sorts of things are very important to preventing fatigue. And you can find all kinds of other additional evidence to support that in the other presentation. Then there are aspects of the socio-emotional environment that affect fatigue. So by social emotional, we mean the things that society drives and how we respond to them emotionally, about perceived demands and expectations that society has or our families have or others around us who are significant to us, those kinds of expectations that they have that we then carry into the workplace. So some of the types of fatigue have been called compassion fatigue. There's an expectation that therapists are compassionate. That's part of our professional ethos, but that takes a toll and can be fatiguing. And there's a presentation about compassion fatigue I would refer you to. Technology, and there's also a presentation in this series all about technology fatigue, but basically the continuous demands of learning new technology and the constant change that comes with technology can be quite fatiguing. Decision making, the more decisions you have to make, it reaches a tipping point, is what the evidence is telling us, that a few decisions can be made well, but numerous ongoing decisions in a rapidly changing environment can be very fatiguing. And there's some links that you can check out for yourself on the handout that goes with this talk. Then there's the social aspect of the workplace that has to do with social action or with the politicized workplace, where there's a lot of perhaps things that people do not understand why they're happening, or there's an inability for senior management to reveal everything that's happening. So people perceive that there are things that are going on that do not involve them, that they have little influence in, or they feel that they must become more politicized to be able to influence what is happening in their environments. So a rapidly changing healthcare environment would be an example of that. And lastly, but certainly not least, are the expectations one's family have, the whole thing we know a lot about, family work-life balance. And again, I would refer people to the other presentation in this series that has much more detail about that. Finally, we're talking about cultural environments. So the culture, one of the things that's come out in the literature that's very interesting is this culture of overwork. We actually have a culture that rewards workaholism, but that can be very stressful and very fatiguing. But what's interesting is that some of that fatigue is buffered by the amount of engagement people feel with their work. But if they're just working because they feel that they must and everyone else around them does, so there's a lot of peer pressure, it can be very fatiguing. There's the cultural expectation in North America of the supermom who can do everything. And we see this strongly reinforced through the popular media and through advertisement. And lastly, the culture of change in healthcare. There's rapid change in healthcare, and people are left either with a fear of being left behind or perhaps of being seen as unprogressive, unwilling to change, without sufficient time to actually look at the change and evaluate it for what it is and to look at the implications of it. So when the pace of change is so rapid, it can be quite fatiguing for people. Assessments and action plans. So we've tried to categorize this in the ideas format. So you identify, you decide what you're going to do, how you're going to tackle it, bite off little bits of pieces, not a whole, one big choking decision at a time is not a good idea. So small things that you can actually do. Engage others. Remember, the issue is not an individual issue very often when it comes to fatigue. There are usually a number of different stakeholders who are involved. Then you act, collaborating with other stakeholders, right? This is where all those little actions start to accumulate. And finally, sharing. Sharing is so important. The ideas and examples that we can learn from each other. So ideas. And then finally, here are some resources that will be helpful for you to get a start on this. And there are additional resources listed on the other slides and on the presentation handout that accompanies this.